Good morning. It's Thursday, September 9th. I'm so happy to be in this chair today for the Doctors In Ask Dr. Arwady. I'm Sybil Madison. I am Mayor Lori Lightfoot's Chief of Staff. I'm here with Allison Arwady. She is our Commissioner for the Chicago Department of Public Health. And as always, this is where you can get the latest information and data on COVID and the vaccine here in Chicago. We want your questions. You can send them to us through Facebook or Twitter using the hashtag AskDrArwady. So we're going to check our distance.
Looks good.
Looks great. And I guess I'm going to turn it over to you to share some data.
So let me just say, I'm very happy to have you back. Those of you who've been following along, Sybil's gotten very busy in her new job, and I'm very honored that she's coming back to talk COVID. So
yeah, I have missed being here with you on Thursdays.
I know, thank you. So if you've got questions, go ahead and start putting them in. But as always, let's take a quick look at our data so we've got plenty of time for discussion. CHI.gov/COVID- is your one-stop shop for Chicago data on COVID. And as you can see here, we are averaging about 455 cases a day right now. This is still over our 400 case per day mark, which puts us as a city still at relatively high risk. It's why we're still wearing the masks indoors. But you can see, compared to a week ago, we are down about 11%. And really things are looking pretty good right now from a COVID perspective. You know, we peaked out here just over 500, and I have been hopeful that this surge would look kind of like the surge we saw back in kind of the April timeframe when Alpha came through and we peaked out around 700 or so. So, you know, we're far from out of the woods. As you know, every state in the country is now on our travel advisory. Delta is very much here, but again, thank you to folks who are doing a good job wearing those masks indoors and especially getting vaccinated. It's the most important thing.
And Dr. Arwady, we've seen more people getting vaccinated during this surge.
We have, yeah. We're seeing about 4,000 a day. At some days we're over 5,000 again, and you know, we'd been down in the low 3,000, so it's been good to see some increase. We are seeing about 34 Chicagoans get hospitalized every day here with COVID, and we're seeing 3 to 4 Chicagoans die every day from COVID. The huge majority of both of these, people who are unvaccinated, and I'll show you some other data on that real quickly. Yeah, we're averaging right now 3,907 vaccinations. I wish it were a little higher, but I'm glad to see it holding steady. If you look at the whole city, 61% of Chicagoans of all ages have gotten a first dose, and 56% have completed their COVID vaccine series. Good, not good enough. We are testing very well, though. We're testing almost 13,000 a day, and in that setting, our positivity is 3.8%. During this peak, you know, our surge here back when Alpha came through, we peaked between 5 and 6% at about 5.7, and actually in this one we haven't even hit 5% yet. So I've been very pleased by that. You know, keep doing a good job on that. I also wanted to just show you a little bit more specific data. So first of all, let me just get into the slideshow view. This, of course, is our community transmission and risk matrix that we've been using all along. So you can see our cases diagnosed per day do remain in that high transmission zone at about 455 per day. It has been just gently beginning to decrease, so that's good, but we're keeping an eye on it for sure. Our test positivity, partly because we're testing really well, remains very good in that lower risk category at 3.8%. And then our hospital beds are in substantial transmission, sort of moderate risk, if you will. You can see, well, we've got about 38 Chicagoans getting hospitalized every day. In total, there are 267 non-ICU beds in Chicago with COVID patients in them, and then 107 with ICU patients, if that makes sense. And you see both of those have moved from the lower into the moderate. Not anything unexpected, though, here. And certainly compared to parts of the country where we're seeing hospital systems completely overwhelmed, especially rural areas where vaccination rates are low. It's been a concern. Here's the updated data just visually on the difference between unvaccinated and fully vaccinated Chicagoans. This first one is cases. You see with this surge, we are seeing more breakthroughs. That blue line represents fully vaccinated Chicagoans, and we are seeing you know, some increase there in terms of some breakthrough cases, but much more so among unvaccinated in the red line Chicagoans. And then
and they look like they're diverging. The lines are diverging.
They are diverging a little bit. Yep. Again, yep, and that's you know, some of that is probably, you know, Is this the surge starting to come back down? We can't fully call that yet, but I expect that divergence just like we've seen. And then if we look at hospitalization rates, it's even more stark here. And this is where we start to get really serious. The difference between, these serious outcomes, people sick enough with COVID. Again, we are seeing some more fully vaccinated people. That tends to be people who are older and or having severe underlying conditions. But by far, the risk is greater among those who are unvaccinated. And then similarly, the death rate much, much higher among those who are unvaccinated. So you've heard us say here that, on average, it's about, if someone gets COVID here in Chicago, they're about 15 times more likely to die if they are unvaccinated versus fully vaccinated. But we also pulled some more specifics here for race and ethnicity. This is Chicago data specifically, and really highlighting in these older age groups especially, the risk is just really substantial. So this is for Latinx Chicagoans who are 55 to 64. And what we have seen right here in Chicago, unvaccinated Latinx Chicagoans, 42 times more likely to die from COVID than vaccinated Latinx Chicagoans in the same group. As you go to people 65 to 74, it's 54 times more likely to die for those who are Latinx. And then as you get older, 75 to 84, it's about 21 times more likely. So we're seeing more split in a lot of ways at that younger group. Yeah. But I mean, just staggering numbers. And then if we look at Black Chicagoans, similarly, Black Chicagoans 55 to 64 are 54 times more likely to die if they get COVID than vaccinated Black Chicagoans. That is the exact numbers of what we've seen here in Chicago. Unvaccinated Black Chicagoans 65 to 74, 20 times more likely, and then 75 to 84, 11 times more likely. And then among white Chicagoans, 65 to 74-year-old white Chicagoans, 22 times more likely to die. White Chicagoans, 75 to 84, 21 times more likely to die. So you get the idea. We're making progress still. These are our 3 zip codes that had the biggest increase in first dose vaccine coverage for age 12 plus since last week. Yep. Shout out to 60639, Austin, Hermosa, Humboldt Park, etc., as well as 60624, another part of Austin, North Lawndale, East Garfield Park, etc., and then 60636, Ashburn, Auburn, Gresham, Chicago Lawn, Englewood, Gage Park, West Englewood. These are some of the community areas that have the farthest to go, and so it's been really nice to see the biggest increase here. So shout out to those communities and everybody working in those communities. And then I want to raise that we've now got 37 zip codes that have hit 70%, having gotten at least a first dose for eligible Chicagoans 12 and up. And this week we added 60652, Ashburn, Chicago Lawn, and West Lawn. So pleased to be continuing to make progress. So I will end the slideshow. Anything you want to comment about that or talk about?
No, I just that's an important milestone for a community to get to 70%.
It is. It's not done, just to be clear.
Yeah.
So, we've been tracking each week. I really celebrate when a community gets half of its eligible residents, because to me, that's just the absolute, at least the majority then, right, have been vaccinated. We celebrate when they get to 60%, 70%, 80%, and sort of there on up. But except for the zip codes right in the loop, every other zip code has room to go. Every community area needs to make some progress, frankly, for the whole city to make progress.
It also makes me think about, and I don't know if this is the right association, but it brings to mind what Fauci said about children, and the way to keep children safe is to surround them with vaccinated adults.
That's exactly right.
And you think about it at a community level, and the way to keep everybody safe in that community is just to have that community full of vaccinated people.
Yep,
right?
It's exactly right. And I think, we've really seen this, that as we have that's this sort of herd immunity is something people talk about a lot. There's no magic number that's herd immunity, but it's recognizing that as you have more people vaccinated throughout social networks, you are also providing some protection for people who are not yet vaccinated. And, I look at, there are communities out in Chicago, in California, where 94% of their adolescents have gotten at least that first dose. It's amazing. We have a long way to go compared to that, but you get settings, schools and whatnot, where 90-something% plus are vaccinated, those are the kinds of settings where you can start thinking about, I don't need to maybe do the masking, I don't need to be sort of doing some of these other things, because given a choice, you'll take a vaccine every time over a mask in terms of being able to prevent. But right now, while we're surging, certainly, and while we're working on getting people vaccinated, we're keeping the mask on.
Yeah. Well, I am very, very excited to see 60636
yes.
on
Why
there as most improved. Well, I just remember doing Protect Chicago Plus.
Yeah.
60636 just kept coming up, and we were just like, what do we need to do? What can we do? So nice to see them being lifted up today.
Yeah, absolutely. And maybe before we get into questions, just one other quick comment is that I asked why you were interested in that one, and I've been doing a lot of asking people why and like what is motivating, not just people to get vaccinated themselves, but to do the hard work of actually helping others get vaccinated. And obviously the folks at the health department, the folks working on our vaccine operations center have been just pouring their hearts into this, right? For, almost a year at this point, in terms of that planning. And,
I think of our community partners too.
Well,
months
exactly.
and months
exactly.
And
months. And so there are, you've probably been reading in the paper, there's some real morale issues here. And I think there can be settings that people just feel very frustrated, right? I get a lot of email from frustrated Chicagoans who say, I've already gotten vaccinated. Why do I still have to mask? I don't care about those folks who aren't yet vaccinated. That's their problem. And trying to really turn that around into if I'm feeling frustrated by this, the thing to do is actually, what can I do to help somebody else get vaccinated? Mm-hmm. And it's been really lovely when you kind of open up the conversation in that way and not just have it be about you and your decision to get vaccinated, which is what our focus has been for a long time. But, even today, as we were walking over here to do Facebook Live, somebody recognized me on the street. And when that happens, I tend to say, are you vaccinated? And he was like, yeah, not exactly yet. And I was like, you got to get vaccinated, right? But just this sort of, trying to have opportunities to have conversations. Because most people in Chicago, if you look at our surveys, about 10%, 1 in 10, truly are like, I'm really not going to get vaccinated. I'm just not going to do it. They say maybe if it's required by my employer, et cetera, but they've just decided they're not going to do it. But about twice that many haven't really said I'm not going to do it. They just haven't also said I am going to do it. Yeah. And so I think just recognizing people continue to have barriers and continue to have legit questions and being a sounding board. So, I remain quite optimistic. I'm happy every time we make progress. And I hope if you're feeling sort of enraged about where we are, that you try to turn some of that into thinking about, are there folks in my apartment building? Are there folks in my church? Are there folks in my neighborhood? Could I volunteer? Could I help call? What could I do? Can I give a ride? Because then it makes you feel like you're working on the problem too.
Yeah, I remember we did a lot of town hall meetings back in the Chicago Protect Chicago Plus days, and it was always important to have people who could tell their stories on the call. And I think the most impactful people were the people who their story included some of that doubt or concern or worry. And then they could talk about how they overcame that and why they ultimately decided to get vaccinated. And I think that it's really helpful when you hear kind of the full arc of the story, especially from someone that you know. So
exactly.
Neighbors talk to neighbors, loved ones talk to loved ones.
So one of my coworkers today, we were talking about this generally on a call this morning, and as many of you know, and we shared this on Facebook earlier in the week, there is now a $100 Visa gift card that is available for anybody who gets vaccinated through our at-home program, through any of the City of Chicago's, on the Vax calendar, the special events, the outreach work we're doing, and it's been great to see groups in particular. There have been some opportunities. People get together, 9 people, 10 people, 11 people get together. And yes, we would not only vaccinate that extended family or that group of neighbors, the people who are coming together, but we would be distributing some of those gift cards. And so one of my employees was like, I just had a great idea. I live in a big apartment complex and there's 1,000 units, and I'm going to reach out to the project or the, the superintendent basically and say, hey, could we think about an at-home? Can we get some people signed up who all live in my apartment building and have this be a party? And I love that, right? It's this sort of how can I turn this into something positive? So anyway, all right.
You can have that Vax party and then you take your gift cards and have another party. Okay, ready for questions?
Yes.
The first one here from Shanti from Twitter. Mask mandates are generally reactionary to increasing infections. I think you need to do A/B testing to measure relative impact rather than directly measure the rate of increase. A/B testing.
Okay, so A/B testing is a term, I think, in communications, but it basically means comparing two interventions. So in epidemiology, we might say a case control study or some kind of study where like one, and what she's asking for, I would love, right? Where you're basically like, these people are going to wear a mask and these people are not, and we're going to compare it. The problem is when you're having a pandemic, you can't really be like, we're going to set this up. We've had some natural experiments, if you will. For example, and a really important thing here in Chicago last year was where some of our school systems were in person and some were not, and we were able to actually compare what were the rates of COVID among students and staff who were in school, and we didn't find that being in school was itself a risk factor for COVID. And in fact, both the students and the staff that were in person school with the masking, with the distancing, with the things in place actually had lower rates than those who did not. We were able to Before vaccine, that's right, exactly. And we were able to compare that and some of those outcomes with students who were learning remotely. So there have been natural experiments, if you will, but I actually love that, what was her name, Shanti, asked this question because there's this really cool study that I actually have a friend who worked on. So a lot of you know I've done a lot of international health prior to this. And when I was in Bangladesh, I'd gotten to know some people who have spent a lot of years working in Bangladesh. And one of them, her name's Laura Kwang, is one of the lead authors on a study that was actually about this. So it's called The Impact of Community Masking on COVID-19, a cluster randomized trial in Bangladesh. You can look it up. And what they basically did is in rural Bangladesh, there is not widespread masking availability, right? It's a very poor country. And so the government didn't have the funding available to sort of make masks widely available. And so they did a randomized control study with 600 villages, about 342,000 adults. Half the villages got masks and some like incentives and reminders and like wear the masks, and the other half didn't get anything in particular. Like if they had masks available, great, but they didn't sort of do a double down. And so what was interesting is, you read about sort of the methods of how they assess mask wearing, and it talks about, mask wearing and physical distancing were assessed through direct observation at mosques, markets, main entrance roads to villages, tea stalls, just the different settings. And then 5 to 9 weeks later, they surveyed everybody they could about what COVID symptoms they had, and then actually collected blood samples 10 to 12 weeks later if they had symptoms to see if they had COVID. And they were able to see in this big sort of nationwide study that in fact these interventions significantly increased mask wearing. Not surprisingly, it went from about 13% in the control villages up to about 42% in the treatment villages. But then also when you looked at this across, in comparison, you did see masks decreasing COVID, right? About a 10% decrease. And that's even in the setting of not the full mask adaptation, et cetera. And so it's one of the first opportunities that actually, as she's asking, how do you separate masking out from everything else? And unfortunately, sometimes in resource poor settings where you don't have the ability to kind of offer everything to everyone, you can answer it. So I'd encourage folks to take a look if you're interested in it, but it was one of the first studies I think that actually has been able to have some comparison and tease out a little bit how important masking really can be and show that it does make a difference, which we've seen, but like in a more scientific way.
Yep. And so it is both proactive. It's proactive, not just reactive.
Yeah.
Okay. I missed this. Dee Ruiz from Facebook. I live in 60652 and glad to hear the news.
All right. Excellent.
Okay. Looks like Journey Page from Facebook. It's been more than 3 weeks since getting the first shot. What is the time frame for the second shot to be effective?
Okay. So just as a reminder, when you get your first shot, and I'm presuming you got, obviously Johnson & Johnson or Moderna, if your recommended dosing interval for the Pfizer vaccine is 21 days. So the package will recommend you get your first dose, and then 3 weeks later, you should get your second dose for Pfizer. And for Moderna, it's 28 days. So you should get your first dose, and then 28 days, you should get your second dose. Where this has been studied well, they basically said up to 42 days between doses is fine, basically, when a delay is not avoidable. So someone's traveling, whatever, if you basically are doubling that time. So instead of 3 weeks later, you're getting it up to 6 weeks later, no problem. Even beyond that, though, if you missed it for whatever reason, you 100% should get that second dose. And they don't recommend that you start over. It's not like you need to kind of get 3 doses if you missed it. It's just that there haven't been as much of the efficacy studies, beyond, if it is beyond the 42 days. So I would just say, get that second dose on time, but if you missed it, no problem. If it's within 42 days, I think you can rest assured it's really just as protective. And even if it's beyond that, this is true actually for almost every vaccine that we give. There are very few you have to start over for. And the most important thing is that you do get that second dose. Second doses, we've done a pretty good job with here in Chicago, in case folks are interested. About 94-95% of Chicagoans have gotten that second dose pretty much on time. Yeah, so it's not been a major problem that we've seen. But if there are folks who haven't gotten it, that's your answer. Even if it was 6 months ago, go get your second dose now.
That's right. So it's been more than 3 weeks, Journey. The time frame is now.
Yes.
Leanne via email, can I get the flu and COVID shot at the same time? What about shingles?
Okay, absolutely. I love this question, and I will answer it every time somebody asks it from here on out. I feel like we might be answering it a lot. Yes, we are. So yes, you can get the COVID vaccine, whether that is your first COVID vaccine, your second COVID vaccine, if and when you get recommended for a booster vaccine, you can get that COVID vaccine at the same time as any other vaccine. That is different than when COVID vaccine first rolled out and we were still, really wanting to make sure we understood side effects, wanting to make sure, you want to be careful, obviously, with a new vaccine. And so at the beginning, there was really a recommendation that if you're giving the COVID vaccine, you separate it, for a certain number of days from other vaccines. But at this point, you can, and in fact, should get them at the same time, just to really cut down on, visits to the doctor and other barriers to getting vaccinated. That is true for children. That is true for adults. Sometimes we get as a follow-up, what if I'm worried about side effects? You don't have to get them at the same time. You can separate them. You cannot get them in the same needle, though. So this is just to kind of, there's no such thing as one shot that's going to have a COVID booster. A combo. There's no thing as one injection.
You can't supersize it.
You can't supersize it. And so it does mean you need to get 2 injections. So people will probably get a COVID shot in this arm and their flu shot in this arm. If you want it both in one arm, they just need to be an inch apart, basically.
And same with shingles?
Yeah. Yep. So it doesn't matter what the recommended vaccine is. Obviously, if anybody's concerned and you want to come back, you're welcome to space them out. But we encourage people, where it makes sense, to get them together. And especially if we are in more of a booster campaign, I strongly expect that we're planning for having flu vaccines combined with booster. The last thing on that, don't wait, because you're like, maybe I'm going to need a COVID booster. Should I wait? I don't know. Please don't wait to get a flu shot, okay? We want folks to be getting their flu shots before we get into the big flu surge. That's how this works. So they're just starting to be available in pharmacies, at doctors now. You can get your flu shot now. Everybody should get a flu shot every year over the age of 6 months, more true than ever this year. So don't wait thinking maybe I'm going to need a COVID booster later. But if you have the opportunity to get them together, and especially if you haven't gotten your COVID vaccine yet, go ahead, do them together.
And let me ask this question. Why are you saying it's more true this year than any other year?
Yeah, so a couple things. One is that we had very little flu season last year, right? Typically, flu is our predictable pandemic, right? Honestly, a bad flu season for us looks kind of like a reasonably controlled COVID season in a lot of ways, in terms of hospitalizations, deaths, et cetera. So they are not equivalent, but there's a lot of similarities where the flu vaccine is not 100% protective. It's actually less protective than the COVID vaccine is, but it's really good at keeping people out of the hospital and really good at keeping them from dying. So not dissimilar from COVID, it's not always going to completely prevent you from getting the flu, but it's great about those severe outcomes. And it definitely cuts down on cases too. So my concern is that with no flu season last year, we have a lot of people who have had even less exposure opportunity to recover than prior years, and I expect we're out and about a whole lot more than we were a year ago to see a flu season, and a flu season that is already a surge for our hospitals on top of wherever we are with COVID really does concern me. So we want, and I don't, these are likely to travel together potentially. We may see respiratory, you don't want flu and COVID at the same time. You really don't. And one vaccine does not protect against the other one. So if you got the COVID vaccine, you have not been protected against influenza and vice versa. So yeah, we really want folks to get that flu vaccine to help protect our healthcare system. And for young people especially, COVID, thank goodness, hits old people really hard in terms of the severe outcomes. It's very unusual for children to get seriously sick, hospitalized, or die, although it can happen. Flu is not like that. Young kids and older people, it's a U-shaped curve, have really bad flu outcomes. So those young kids, 6 months, up to school age, especially important that they're getting their flu vaccine, even though COVID's not available yet.
All right. Here's one from Maureen via email. I will be traveling out of the country at the end of the month. What steps should I take before and upon my return?
Okay. So, Maureen, I don't know where you're going. I would first of all encourage you to pay really close attention to the travel advisories that are coming out internationally, because the U.S. is, no surprise, not doing very well right now from a COVID perspective. And so we have seen Europe, for example, has re-implemented its restrictions on travelers. We've been added to the bad list, if you will. So if you want to travel to many countries in Europe, you can travel, but you need to pay to stay in one of the quarantine hotels on your own dime for 14 days before you can go out and do anything. Wow. So I would just encourage you to pay close attention to that. I am assuming you are vaccinated. Please don't travel if you're vaccinated. There's a good chance you won't be able to travel if you're vaccinated, again, depending on the country.
If you're unvaccinated.
I'm sorry, yes, did I misspeak? Yeah, I'm assuming you're vaccinated. If you're unvaccinated, there are many countries that aren't letting you travel at all. What I would recommend is that you look, in the country, look at the U.S. Embassy, Consulate, et cetera, for that country to get the most up-to-date guidance, and also check the airlines, because they will have good information. Many countries require not only the proof of vaccination, but a proof of a negative test. So I am encouraging people, even just to cut down on it if you're not entirely sure, get a test before you travel. Have one, a PCR from a lab ready to go, because otherwise, you could get charged a lot in an airport somewhere. They're not going to let you in. And then coming back to the U.S., you're pretty much also going to need to get a COVID test. And so your airline can help you sort out how to do that. The country you're going can get it, but you'll need to have some additional testing, generally speaking. And then please wear the mask while you're traveling. You'll see that countries around the world are actually masking more than a lot of the U.S. is. So you won't probably feel too out of place doing that, but please do. And then just on your return, I would encourage you, again, this is assuming you're fully vaccinated, just be extra careful. I wouldn't see somebody, that first week after you're back who's at really high risk for COVID, and just watch yourself for infections, be a little bit careful. So, travel is happening, and I love travel, so I'm glad it's happening at some level, but you do just want to take some of those extra precautions, and you don't want to get stuck in a country with things changing, so pay close attention. The CDC travel list will tell you what level advisory for U.S. citizens to travel it is, and but then other countries also have their own lists and requirements.
Yeah. Important to check.
Yeah. Why I didn't get to go to Ireland this summer like I was hoping to.
I was going to ask.
No.
Oh.
It's all right. It was a level 4 from CDC, do not travel, and then it's actually now back on the you have to quarantine if you're from the U.S. list on their side too, so wasn't going to happen.
2022.
Yep.
All right, Carlos Sanchez from Twitter. Hi, Dr. Allison. I am fully vaccinated, but I'm aware that breakthrough infection is still possible, especially as immunity wanes with time. Were I to get sick, are there recommended treatments for the symptoms, whether it be over the counter or through my doctor?
Okay, good question. First, thank you for getting vaccinated. Obviously, that's the most important thing. And you can rest assured that in case you were to get vaccinated, again, your chance of getting seriously ill, hospitalized, or dying has been cut dramatically, like we said, not knowing how old you are. What I would say is that we still do not have great prophylactic treatments available. So again, this is something that is different from influenza. We've had decades and decades and decades to study influenza. So there are medications that if you get diagnosed with influenza, you can start taking that medication. Tamiflu is one example, right away, and it decreases your chance of getting a serious infection. There is nothing like that at this point for COVID. So the other thing just to kind of talk about is that for people who are unvaccinated, who we are the most worried about, if they are at high risk for severe COVID outcomes, there is the potential for getting monoclonal antibody treatment. We talked about this a little bit on Tuesday, but that is only for people who are unvaccinated, and it's basically just trying to make up for the fact that you were not vaccinated by, giving you some passive immunity to try to help sort of catch up for that. So for someone who's fully vaccinated, first I would encourage you to talk to your doctor, okay? If you're doing a test at home, for example, or you're not getting tested, please call your doctor. Let them know, that you're positive, and it's likely just going to be supportive care for the great majority of people. That means, staying home, staying isolated. It is important, no matter what your symptoms are, that you isolate for the full 10 days, okay? And that, if you have a fever, you should take the Tylenol, the ibuprofen. This is generally speaking. You should, of course, talk to your doctor. And you may want, for example, we've seen people, have some of the at-home pulse oximeters. If you're worried about it, just check your oxygen level. The main thing is you just want to pay attention to not, if you're starting getting more seriously ill, not to delay care. There are some people who like to take different vitamins. You're welcome to do that. We don't have evidence that any of them do a lot in terms of necessarily preventing it. And please don't go taking a whole bottle of vitamins. If you decide to take vitamins, take the amount that's recommended really on the bottle. But yeah, we don't have at this point still. I think it's one of the breakthroughs we're still waiting for. I'm hoping at some point we will have an oral medication that people can take that would help prevent. But really it would be...
So you shouldn't go and get cold or flu.
You could, symptomatic medicine is fine. You can take cold and flu medicine. If you got a runny nose, you can take the one that helps the runny nose. You can take the thing for the fever.
So match it up with
what your symptoms are. You want to drink a lot of fluids for sure. Keep from getting dehydrated. But there's not a COVID-specific treatment that has been proven to decrease the risk of symptoms. But go ahead and take all of like you would if you had the flu, or like you would if you had something else and you're not feeling well. You can take all that over-the-counter stuff. Just make sure that you isolate for that full time, and then call in case you do get worse.
All right. Hopefully Carlos will not have a breakthrough experience. All right, Faye State from Facebook. When will kids be able to get vaccinated? Okay, so another question I do not have the full answer to yet, and we will keep you updated as we learn more. Here's what I can say we know at this point. Pfizer, Moderna, and J&J are all doing trials in younger children. The cohorts that are furthest along are the 6 to 11-year-olds, followed by the 2 to 5-year-olds, followed by the 6 months to 2 years. I anticipate any approval coming in that order. So it's really the 6 to 11, possibly 5 to 11, but probably 6 to 11 that we're going to see next. Pfizer is the furthest along, and just so you know, there was a decision. The FDA is very conservative around vaccines, especially childhood vaccines, and we really want to make sure, especially given that kids are less likely to have the severe outcomes, that these vaccines are absolutely safe, that they're dosed appropriately, right? They're having the right immune response. There's a lot of things that just make it a little more complicated, and we're being extra careful. And so they extended the trials a little bit to enroll some more kids, to make sure the dosing was good, to make sure there were no signals related to this cardiomyopathy, heart issues, anything like that. And so that's part of why it's a little bit, it's been pushed back just a little bit, but we have to wait for the science. You can't hurry it up. You've got to be really confident, especially for childhood vaccines, that we followed all the protocols we normally would. So Pfizer may wrap up the first part of that trial in the next month, give or take, sort of October-ish. I expect it will then take at least a month for the FDA and the CDC, the ACIP, to review that data, really make the recommendations. And if they decide to grant an emergency use authorization, I don't see that coming before November at the earliest. I think it's possible for younger children, it's possible they could say, you know what, we're not going to actually grant an emergency use authorization. It's not as much of an emergency, quote unquote. It's possible they could
could wait for the full licensure, which would be more like January, February. I don't think that's likely to happen if we're seeing a big surge, and we've been seeing, not so much here in Chicago, but across the country, you know, a lot of kids getting sick and spreading COVID. So I do think we'll see an EUA, but I don't think it's likely before November. And then I would anticipate the other companies to be a little bit behind that in terms of timing. We will keep you posted as we learn more, but we're just waiting for the studies. The studies have to get finished, and just know that it's to help make sure that when we stand behind a vaccine, we can absolutely say that it is safe and it is effective.
All right. I think I'm going to sneak in one last
Okay.
question from Deb Beasley, also a timing question. Any info on when the J&J and Moderna vaccinations will get FDA approval?
Yeah, good question. So it's been interesting. So Pfizer is a very large company, right? It's a big worldwide pharmaceutical company, lots of capacity. Moderna was really quite a small company, like prior to the COVID vaccine, and just has not had as much capacity at any point. So even though the technology for the Pfizer and Moderna are the same or similar, it's just been a bigger lift at all points. Moderna has needed to grow its scientists, it's needed to grow its manufacturing capability, it
had to scale up.
It had to scale up a lot. And so it's always been just a little bit behind, again, because you can't cut corners. You have to turn in all of the appropriate safety data. You have to just do it. And so it's been actually really nice to see a smaller company they'd been working on mRNA vaccines for a long, long time. They were the pioneer in a lot of ways in this area, but it had always been very small, and so they've really grown a lot. So the point is, they're a little bit behind, and then J&J is using a different platform, right? So it's not the mRNA vaccines. As you know, they've been the single dose. There's been a lot of things that have been different all along. Moderna has already submitted data, perhaps all the data that is needed, to FDA. So I would anticipate soon seeing that Moderna full authorization, full approval come through. The safety data is all good and all in. This, again, remember, is the manufacturing and some of those other pieces that come before you get the BLA. So I again, don't have a crystal ball. I don't know for sure, but I am anticipating we will see, what month is it? September. You know, my guess would be in the next month or so, we may see that come through for Moderna, and then probably a little bit after that again, J&J.
All right. Hey. We started out with some good news about communities that are making lots of progress. Any other good news that you want to share, Doc?
You know, I think really I'm also, my mood for the last year and a half rises and falls with sort of how COVID is going. And we are far from out of the woods, but I've been very reassured by how Chicago broadly has sort of responded to this surge. And especially when I've been reading these stories, you know, I got a lot of friends who are in medicine all over the country, just in desperate straits again, you know, in the hospitals and whatnot.
Which must feel really demoralizing.
Yeah, really, people are very depressed, and it's really hard to take care of people who come in seriously ill, and, you know, you're trying to get them the antibodies, which isn't as good as the, you know, and you're trying to sort of treat them, and, you know, and it's not, you know, I think generally people who work in medicine are pretty compassionate, right? They're going into it, they want to help people. And there's been a lot of interesting things about how I maintain that, you know, when I'm feeling just worried about people. So anyway, I would just like to give as a shout out, a thanks to everybody, you know, on the vaccine side, on the healthcare side, that's continued to work, I think, keep this conversation respectful, continue to encourage people to get vaccinated, not demonize them, and that, you know, right now things have really flattened out, and in fact even perhaps starting to come down here. So I feel very happy about that too.
Yeah, I mean, I don't think that we say it enough. The whole team, you, your team, everybody in the community that's been working on this, I mean, has done a fantastic job of protecting Chicago.
Yeah.
I mean, I don't think any other large city has managed this pandemic in the same way. So,
yeah, I mean, there's a long way to go. You never have all the answers at all, but I think I've been, you know, our goal, remember, to stay open and to stay careful. And those are hard things to balance, but, you know, so far we're doing okay there. And, you know, I feel happy about that, and I really want to thank Chicago for being part of that.
Yep. All right. As you said, still more work to do.
More work to do. Make your story not just about getting vaccinated, but getting somebody else vaccinated. Then you can share it at Thanksgiving.
Okay, on that note, I guess we're signing off until Tuesday.
We're signing off. We'll see you back next Tuesday. Take more of your questions. Thanks for tuning in.